We've all experienced it at one point or another, especially as we age, the nagging stiffness in our neck, or perhaps that sharp pain in your lower back that just won't go away. You might be thinking it's just a little pain or stiffness, nothing to be concerned about, but then what if it's more than that? What if it's lingering? What if you still have it a year later? Today, we are talking about the most common causes of neck and back pain, how to treat them, as well as answer your questions on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I am Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. Let's start things off with a Facebook question from Mitch. Mitch asks, "Hey, Dr. Brew, I'm a gym rat who likes doing lifts and curls, but I've noticed recently that I've lost some strength in my arms, especially my right arm. Additionally, I felt a little numbness. What could it be?" Mitch, without seeing you and doing some tests, physical exam, some imaging, it's difficult to answer your question. But if you were to bet, it sounds like your symptoms are going to be coming from a disc in your neck. It's a common problem. And when a disc degenerates or herniates, it may start to compress a nerve. Now, with nerve compression, you have symptoms going down wherever that nerve travels. So if you compress a nerve between the fifth and sixth bone in your neck, you'll start to feel symptoms down to your hands, possibly to the area around your thumb or the index finger. Now, imagine if you compress this nerve longer. Now you go from pain to possibly numbness and then possibly weakness. And if that disc is pushing on a spinal cord, you may have symptoms going to both extremities. So this isn't something that I think is reasonable to ignore. I don't think that you should be concerned as in you're not going to be paralyzed. Chances are it's very unusual for this to cause some kind of like a irreversible problem. But that being said, you definitely deserve some attention and definitely an MRI. I hope this helps. Our next question comes to us from Colleen, who reached out on our YouTube page. Colleen's question is, "Hi, Dr. Brusovanik. I'm in the 7th month of my pregnancy, and I've recently been experiencing some slight pain and numbness in my left leg, which is weird. My OBGYN thinks that my pregnancy might be causing me to have sciatica. What do you think, doctor? If it's true, what can I do?" Colleen, thank you for reaching out, and I'm sorry you're experiencing this pain. Now, sciatica, specifically to those who are watching, is a common way to describe back pain that is felt down the extremities. So oftentimes, sciatica specifically refers to pain down the back of the thigh, back of the calf, maybe the side of the thigh, side of the leg, and it's very common. Now, when a woman is pregnant, her body is replete with elastin and other hormones that make her a bit more stretchy, make all her tissues more stretchy. It makes tissues more permeable. And if a disc becomes more permeable, as in if the lattice framework of the outer shell of the disc starts to allow some disc matter to sneak out, then a patient may start to experience common inflammatory symptoms related to nerve irritation. So that's numbness down the leg, maybe even weakness down the leg, and definitely pain. So there's sciatica, and that's why pregnant girls oftentimes have it more often. Now, in addition, there's additional weight with carrying a baby, and if a disc is problematic, additional weight may cause that disc to become symptomatic as well. I'm really sorry you're suffering, Colleen. I know a lot of MRI centers that will refuse to see someone who is pregnant. I know that treatments are really limited. Now, one thing that I can advise you to do is talk to your OB and see if you are safe to take a week-long steroid pack. So it's a short course of steroids. You know, steroids are the world's greatest anti-inflammatory. And hopefully that will quiet down whatever redness you've developed behind the disc that's causing the sciatica or the pain to go down your leg. I hope this helps, and I'm sorry you're suffering. Andrew reached out to us on our YouTube page, and his question for me is, hey, Dr. B, I was playing hoops last week with some friends, and as I went to grab a rebound, I threw out my back, and the pain was excruciating. I was so bad, my friends had to drive me home, and I've been laid up ever since. Does this mean I have a slipped disc? Andrew, I'm sorry to hear that you're in pain, and it's important to reiterate that without a full examination, my evaluation is not valid. I can only sort of guess about some of those important elements from your story. So if playing basketball is something that you commonly do, then you can overdo it, pull a muscle, and that course, the course of a muscle spasm, is, as you'd expect, maybe a week at most. Now, if you are laid up for more than a week and you start to have symptoms going down the leg, then you deserve attention. You deserve an MRI for your lower back, a physical exam, and a conversation with a doctor who is going to listen to you, who is not going to rush you, and who is going to address your concerns. In general, intermittent pain going down the leg is a sign of a degenerative disc and is not part of the muscle spasm kind of a condition. And the muscle spasm shouldn't be something that's there after lifting a book or a cat. You know, playing hoops, though, that can definitely cause a bit of a spasm, especially in someone who perhaps isn't playing all the time. In case you missed it the first time, here's another opportunity to find where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Laura sent this question in via our own website, allhealthtv.com. Laura asks, hello, doctor. I've been experiencing pain in the back of my head and buttocks, as well as IBS, which I'm assuming she's talking about irritable bowel syndrome, and a slight case of brain fog. Full plate, I know. Anyway, my chiropractor thinks I could have rheumatoid arthritis, but I'd like a second opinion. Laura, I'm sorry you're not feeling well. However, that said, I commend you on trying to obtain a second opinion. You know, most physicians are well studied, but nobody's infallible. And what your chiropractor is telling you, it sounds reasonable and deserves further questions. So rheumatoid arthritis is a condition where our own immunity starts to go after various parts of our body. Specifically, with the most common form of rheumatoid arthritis, you start to attack the area around the joints. So not the joint itself, but areas around the joint. So when patients complain of things that seem related, like pain to both shoulders, both elbows, both wrists, both ankles, or some combination of that, your chiropractor appropriately thought of rheumatoid arthritis as a possible cause. A common misdiagnosis of somebody like you is to label you as having fibromyalgia. And I strongly oppose that diagnosis, as I don't think that that diagnosis has true scientific merit. Now, it's also possible to have two common things. So pain in the back of your head could be related to neck pain, could be migraines, and could be something related to the head itself. Pain around your buttocks could be related to low back pain, and many of my patients actually present with both neck and back pain. Now, irritable bowel syndrome can be there in itself, and it can also be an unrelated problem. So all of these can cause brain fog, especially neck pain and headaches in the back of the neck. So this is what I'm talking about. A case like yours, which is not rare, deserves real attention. It deserves somebody who specializes in these conditions to piece it together and provide you a reasonable plan that will lead you to achieve a pain-free life. So I would advise you to obtain a neck MRI and lower back MRI. And I would advise you to obtain some labs to ascertain whether rheumatoid arthritis really is a possibility. Laura, I hope this helps. Okie dokie, we've got another question from allhealthtv.com. You should really check out our site when you get the chance. It's chock full of really great information. Jeff asks, Dr. Brusovanik, I was an athlete in college and saw a little too much action in Afghanistan. As such, I've been experiencing neck pain and numbness that extends into my arms. I know I should go see my GP, but I thought I'd reach out to you first. Jeff, you're right. If you're experiencing these types of symptoms, you should absolutely get yourself checked out. You should get to a doc. Now, I want to say thank you for your service as you've served in Afghanistan, and I'm sure that that's not easy. I have had a lot of patients who have a history of military service, and there are some specific things that we should discuss as a veteran, because you may have been exposed to things that a common patient isn't exposed to, obviously, explosions, certain specific trauma, etc. Now, if pain goes towards your arms, then you deserve an MRI of your neck. A physical exam is just not going to cut it. And if you are in a state where MRI centers require you to be seen with health insurance, keep in mind, you can always come into a center and pay cash for an MRI, and you may be able to save a lot of money. You don't need to go through all the hoops to get an MRI. And if you can't get a prescription, then feel free to reach out to me or to any doc that's reasonable and caring, that is going to show you the path to getting better. Now, generally, these symptoms of neck pain going towards your extremities are not dangerous, but numbness is starting to be concerning, because numbness implies that the nerve may be actually getting sick. And as my old chief in training used to say, nerves can't take a joke. So experiencing numbness does imply that you deserve some form of intervention reasonably soon. It would be a good idea for you to be seen right away. I hope this helps. This next question on YouTube was sent by Judith Ann. Judith Ann asks, good day, Dr. Brusovanik. I've been playing a lot of tennis at the club, and it's getting progressively more difficult to play because of the pain and numbness I'm experiencing in my neck and arms. So I've been doing a little research, and I've got, and it's got to be either a herniated disc or a degenerative disc. I'd love to get your thoughts, doctor. Judith Ann, thanks for reaching out, and I'm honored that you'd like my opinion. I think you should really see somebody local to you that can examine you or fly in to see me so you can have a proper physical exam, and you need an MRI. So that being said, your assessment is correct. Neck pain that's progressively worse is a very common sign of a degenerative disc disease. If you're starting to have numbness, if you're starting to have pain going down to your arms, that implies that either the disc has become so wide as to start irritating the nerves, and now the nerves are affected, or there's a strong inflammatory process. So just because you have numbness doesn't mean that you're doomed and that you have to have surgery, but you do deserve an evaluation. This is a very common problem, and I would often say to patients, let's be conservative with treatment, but let's be aggressive with diagnostic measures. And there's really no harm in obtaining an MRI. So I appreciate your question, Judith Ann, and to those who are listening, who are suffering, please, it's a really straightforward thing. Let's get an MRI. Ask your doc to give you a prescription. That should be no difficulty whatsoever. If not, I'm happy to provide one for you. If you've got questions, we've got answers. And just in case you missed it the first couple of times, here's yet another chance to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Oren just sent us another question on YouTube. Oren asks, Dr. Brusovanik, my cousin Darren was diagnosed with osteoarthritis, which got me thinking, my back's been bothering me lately, so I'm wondering if osteoarthritis is hereditary. Oren, that's a great question, and thank you for sharing it with us. So, in order to see if osteoarthritis is hereditary, we'd have to show a certain predilection for osteoarthritis within a family. But osteoarthritis is so common that unless it's a variant, like, for example, rheumatoid arthritis, then it's very difficult to say whether it's indeed hereditary or not. Now, rheumatoid arthritis would affect your spine via very specific means of joint erosion and possibly a type of instability, which would be important to diagnose if you are having neck pain and pain going down the arms. Now, with the low back pain, rheumatoid arthritis would cause joint erosions and back pain, but osteoarthritis, which was traditionally thought of as a non-inflammatory condition, will also present with sort of waves of symptoms. So, Darren, regarding the connection between your pain and your cousin, I wouldn't worry. But regarding your back that has been bothering you, you deserve an evaluation. Just like any other part of the body, if you have pain, then you deserve a diagnosis to figure out why you are having pain. And then you'll be able to decide whether treatments are reasonable and whether they're indicated. Thank you for your question. Our next spine-related question comes to us from Gigi, who reached out via Facebook. Gigi wants to know, hi, Dr. Brusovanik, I'm a little anxious about something. The nurse at our daughter's school said that she thinks that Dahlia, our daughter, is favoring her right side as she walks, which might be indicative of scoliosis. Just what the heck is scoliosis? Gigi, thank you for reaching out and for taking a proactive role in your daughter's health. So, scoliosis is a curvature of your spine. Up to a certain degree, it's considered to be a normal variant, and beyond about 10 degrees, scoliosis may pertain certain long-term implications. So the importance of age cannot be understated because scoliosis gets worse as we go through our growth spurt. Essentially, when you take your kid to see a doctor about scoliosis, a lot of the questions will be aimed at figuring out how much more growth is left and how far is your daughter within that growth curve. So scoliosis has a lot to do with growth, and as doctors, we try to catch it before it starts to get worse. Now, that being said, if your daughter is an adolescent, then it's important to take sort of like a conservative approach, meaning you may want to get x-rays over a period of time and see if there is progression. On the other hand, if this is something where your daughter is just a little baby, that deserves a more significant attention, because if there's an underlying process like a butterfly bone or a trapezoidal bone in your spine that will really predispose that scoliosis curve to get worse, then your daughter deserves sort of reasonably quick attention. So a bigger issue is specifically to your daughter's favoring of one side when she walks. It could be related to scoliosis, but this highlights the importance of seeing a doc, because if your daughter is somewhat overweight, and if she is, let's say, between the age of 9 and 13, she may have what's called slipped capital femoral epiphysis, SCFE, as we call it in orthopedics, which is a condition of the hip. A mushroom head of growth, a growth plate on top of the femoral head, sometimes shifts in a child and may cause predilection towards the other side. So that's another reason to see a doc and obtain a proper physical exam. Thank you for this question, Gigi. I guess it's an all health TV kind of a day. The next question comes to us from Dan. Dan asks, hello, Dr. Brusovanik, I have degenerative disc disease, and I'm not in a rush to go under the knife, so I'd like to know what are some non-surgical treatments for chronic back pain. Dan, thank you for reaching out with your question. So, look, it would be exciting for me to tell you about the myriads and myriads of treatments that are effective that will get you to avoid surgery. But if you go the evidence-based route and you look at studies that were published by authors who were not getting paid by the industry, authors who were ethically and under the supervision of what's called an independent review board, did reasonable ethical studies. Unfortunately, the conclusion is not great. In the realm of what works for degenerative disc disease specifically are three things. It's time, steroids, and surgery. So as you pose the question, what's non-surgical? Really, it's time and steroids. If you do a treatment for the next 72 sessions, you may get better. But did you get better from the treatment or the fact that the natural history of pain coming from degenerative disc disease is to wax and wane? So I caution anyone who is being prescribed a long-term treatment from assuming that the treatment made them better. Be objective. And if a treatment is making you feel worse, please don't believe the mantra that, oh, if it hurts, that's good. So steroids. In the realm of what works, steroids work. So for acute episodes, a short course of steroids does the job. That's what I would do if I have sudden back pain. And I think once, twice a year, it's not dangerous to take a short course of steroids. Now, if you know exactly where the pain is coming from, which requires an MRI, then a more effective solution is a properly targeted injection. So injection is just a way to deliver medicine. And in the realm of steroids, for degenerative disc disease, if you take a drop of steroids and you deliver it behind the disc that's causing your pain, the pain will be gone. So a lot of patients write to me and say, well, I tried injections, nothing ever worked. Well, then your pain is not coming from where the medicine was put in. And if you've had trigger point injections, that means nothing. If you had facet joint injections that didn't help, then you don't have facet pain, but you could have disc-related pain, and there are multiple discs that frequently cause pain. So don't be disheartened if in your history of treatment for your back pain due to degenerative disc disease, you've had injections and it didn't work. Get a better doc, get a better MRI, reassess, and get back on the horse, because you don't have to live in pain. Thank you for this question, Dan. So the next question comes to us from allhealthtv.com, and it's coming from Greg. Dr. Brusovanik, how does dehydration affect the spine? Greg, that's an excellent question, and I'm sure it's on so many viewers' minds. It would make sense that if you're dehydrated, your discs will be dehydrated as well. Well, there's no evidence of such. So dehydration over a long period of time may be associated with disc disease, but there just isn't a study to prove that. And because long-term studies on degenerative disc disease show that we all get it, but not all of us are symptomatic, the focus has always been on delivering effective patient-centered care as opposed to treating the MRI. We are getting close to reversing disc degeneration, or at least to slowing it down, but we're not there yet. And as a person who is strongly interested in the stem cell realm and stem cell research, we're not ready to deliver stem cells to your spine. The next question comes to us from Emily. Emily sent to us a question through YouTube. Hi, Doc. What's the difference between spondylolisthesis and ankylosing spondylitis? Emily, that's a great question. So spondylolisthesis is a condition that occurs either from early in life or later in life, where in both cases, due to different causes, the upper part of the spine starts to shift forward on the lower part. Patients will frequently say that when they bend backwards, it hurts, and they will feel like when they stand up, they can't stand up straight. In the younger population, these patients will often say that they have an easy time reaching their toes, but they can't lay on their back. So that's spondylolisthesis. Now, ankylosing spondylitis is a much more rare condition that causes our bones, or actually our soft tissues, to turn to bones. And it will cause mostly the elderly to walk in a very flexed forwards posture. These conditions aren't related, But if your doc is talking to you about ankylosing spondylitis when you have spondylolisthesis, then that's a big red flag, and I would get a second opinion. I hope this helps. Layla sent us a question on Instagram. Hi, Dr. B. Can sciatica cause hip pain? Layla, that is really one of the most important questions, because we all call a hip different parts. We may say it's at the upper buttock. We may say that it's the side of our hip, or it's the groin. We may refer to our hip joint, which would cause groin pain, the hip muscles, which would cause pain on the outside of our hip, or buttock pain going down the back of the thigh, which could be actually coming from your back as well. As a spine surgeon, I spend all my time figuring out exactly what the problem is. And when you see a doc, make sure you get a feel like they are listening to you and they are addressing your hip pain, I hope this was an interesting show, and please continue to send in your questions. Thank you for joining us on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.